Welcome to this afternoon Committee of Health and Human Services. Would the Secretary please call the roll?
Assemblywoman Gonzalez.
Here.
Assemblywoman Gorlow.
Here.
Assemblyman Gray. Assemblyman Hafen. Assemblyman Hibbets.
Here.
Assemblyman Koenig.
Here.
Assemblywoman Newby.
Here.
Assemblyman Nguyen.
Here.
Assemblyman Orntlicker.
Here.
Assemblywoman Taylor.
Present.
Assemblywoman Thomas.
Here.
Chair Peters.
And I am here. Thank you so much. Okay, first order of business today, we have a committee bill introduction. Same thing we've been doing. This does voting to pass this into the floor so that we can get it referred to committee and hear the bill. Doesn't obligate you to the bill at all. All right. BDR number 325 revises provisions related to planning for the provisions of behavioral health care. Do I have a motion to introduce BDR 325?
So moved.
Thank you. Thank you. I have a motion from Assemblywoman Gonzalez and a second from Assemblywoman Newby. Is there any comment or discussion on the motion? Seeing none, all those in favor, please say aye.
Aye.
Any opposed? The motion carries with those present. Please mark on the record that Assemblyman Gray is in the room.
I apologize for being late.
Thank you so much. So wanted to make sure we got that through. General housekeeping items. We've been through this several times, but just a reminder, please silence your phone and your computer. So we're not interrupting people during the meeting. Public testimony can be made in a variety of ways, including in person and via mail, email, fax, etc. Actually, is fax, Patrick? I'm sorry, Mr. Ashton, can we still do fax? Last session we could do fax, but I couldn't, I don't know if we had, I may revise my statement on fax.
What's the facts?
What's a fax? Regardless, there are several ways to provide public comment. We will have public comment period at the end of the meeting today, but written public comment can be submitted before, during, and up to 24 hours after the meeting's adjournment. If you wish to testify in person, please sign in at the table by the door and leave a business card so that we can get an appropriate record. Anyone who would like to receive electronic notifications and access to the committee meetings material can do so by signing up on Nellis, the legislative website. To ensure orderly flow of discussion, again, I just request that all comments and questions come through me, and you will be recognized by me before you can speak. When testifying in person, please remember to turn on the microphone and turn it off when you're not speaking so we don't get that reverb back in Las Vegas. All right, we're going to move on with our agenda. Today we have presentations on food security. This is a hot topic item, as we heard a couple of days ago. We are dealing with the unwinding of the pandemic relief resources, including SNAP benefits and other benefits that our community members may be dependent upon, and food security is one of the components that impacts our families specifically during this period of time. We have several folks presenting today on food security issues. First, we have the Council on Food Security, and then second, we will look at childhood food insecurity in Nevada. I would ask that the presenters for Council on Food Security presentation please come up to the desk. Thank you so much. Oh, great. Okay, thank you so much, Dr. Osgood. Good to see you. Please introduce yourself when you're ready and proceed.
Thank you. Can you hear me?
Yes, we can.
Okay, thank you. My name is Dr. Ken Osgood. I'm a member of the Council on Food Security, and I've been asked by my colleagues on the council to make this brief presentation to let you know a little bit about the council, since so many of you are new members to the legislature, and to give you a little bit of history of the accomplishments that we, with the working together with the legislature, have accomplished over the last few years, and then to close with some suggested legislative actions for this coming year. I have with me in the audience two other people. One is Marcia Blake, who is the Executive Director of Helping Hands of Las Vegas, Nevada, and she is also on the council, and she can, I'll explain as we go through the report, or through the presentation, what expertise she has. And we also have Regis Whaley from the 3 Square Food Bank, who is the Director of Advocacy and Research, and has helped us collect a lot of our research and has kept us on track for many years. He's here also to help out. Could I have the presentation that I submitted shown on the screen?
We can see
Very
it.
good.
Oh, great. You can see it as well.
Okay. Do I ask you to change slides? Because I don't have a button here.
Yes, we have someone up here who can change the slides for you.
Oh, okay. Okay, well, this is going to be, what we plan on doing is having a very brief presentation from me, giving you the background as I've just suggested. And then Sarah Rogers, who supports our council and is part of the Department of Health and Human Services. She's the Nutrition Unit Deputy Director. She will make a presentation of the details of things relating to kids in this that's currently going on. And then we'll open it up to questions. We recognize we've only got about a half an hour or so, so we'll move through this as fast as we can. If it turns out you want to interrupt either me or Sarah, please feel free to do so and let me know. Can I go to the next slide, please? This is just a brief history of our council. In February 12th of 2014, when Governor Brian Sandoval and his wife, who was a social worker, recognized that there are some significant issues with food insecurity in the state, held a meeting and a meeting of a whole group of both government and non-government people together here in the state. And out of that came Governor Brian Sandoval's establishing of the Governor's Council on Food Security per an executive order. In 2019, that council was made a permanent part of the Department of Health and Human Services. We have many obligations and duties, but I've just highlighted two that are germane to this session. One is we are to review and comment on any proposed federal, state, or local legislation and regulation that would affect Nevada food policy. And second, we're to advise and inform the governor on Nevada food policy. Next page, please. For those of you who don't know what food security and insecurity is, a broad definition of conceptual definition of food and nutrition security was established by the Life Science Research Office in 1989. For those of you who are around at that time, a significant public and private effort was done in the 60s and 70s, which resulted in the elimination of food insecurity in this country. It recurred in the 1980s, and it reached the point that the federal government decided we better measure it and monitor and see how we can control it again. That's when these definitions were formed, and they are the same definitions today. The definition of food and nutrition security is my second bullet that we put on this slide, and it reads, it's the ready availability of nutritionally adequate and safe foods and an assured ability to acquire acceptable foods in a socially acceptable way, without, for example, without resorting to emergency food supplies, scavenging, stealing, or other coping strategies. Next slide, please. Food insecurity exists whenever availability of nutritionally adequate and safe foods or the ability to acquire acceptable foods in socially acceptable ways is limited or uncertain. Next slide, please. What are food deserts? Food deserts are identified as census tracts with low income and low access to nutritious foods within 1 mile in urban census tracts or 10 miles in rural census tracts. Although food deserts are not included as the social determinants of health, which we will not be discussing, they are presented here because they are a known barrier for food insecure older seniors. The term food desert describes areas of lack of adequate access to healthy foods, typically in the form of a supermarket. The USDA identified food deserts in 58 of our 688 census tracts here in Nevada. Those living in food deserts may have inadequate options to obtain fruits and vegetables and subsequently may have difficulty meeting the dietary guidelines. Next slide, please. This is a graph, and I thank Regis for preparing it on behalf of the council, that shows where these census tracts are. You'll notice they're in both major urban areas of Reno, Sparks, and Las Vegas, and in many of the rural areas. Next slide, please. We know from years of study, academic study, that food insecurity has been linked to health-related, both mental and physical health-related illnesses that we as a society are spending a substantial amount of money to treat. When we eliminate food insecurity, we eliminate a substantial percent of people who have these illnesses, and it turns out that the research shows that we spend a lot less money on the prevention of food insecurity than on the mental and physical illnesses that food insecure people subsequently get. Those that have been scientifically linked to food insecurity, those illnesses and injuries include obesity, diabetes, cardiovascular disease, anemia, depression, anxiety, poor self-reported health, lower quality of life, functional impairment, cognitive impairments, and shorter life expectancy. Next slide, please. In order to be food secure, everything listed on this slide, these social determinants all have to be met. The lack of any one of them can result in food insecurity. You have to have enough financial resources to purchase healthy foods. You must have available transportation to obtain the food. Knowledge about which foods are healthy and which are unhealthy. You have to have that knowledge in order to purchase and consume the correct foods. You have to have available food preparation and storage facilities in your own home or where you live. You have to have assistance in obtaining food and or preparing meals when a physical and or mental disability is present. So you need many people need caretaker services. You have to have access to healthy food. You have to have you have to be physically safe and have mental living conditions with adequate activities of daily support services. You have to have regular eating patterns, and recently it's been shown that you have to have an understanding of information technology and its implementation in order to obtain and not be food insecure. Let's move on to the next slide, please. This is just a summary of how we in Nevada compare to the rest of the country over the last 20 years, basically. This is a brief summary. And if you'll notice, in the first line of 2004 to 2006, we in Nevada had 3.9% of our population were food insecure as very low. And if you consider the low and very low, which we still consider we need to intervene on, we had 12% of our population versus the United States' average of 13%. So we were below average. After the Great Recession, we jumped to above average. If you'll notice, we had 16.2% of low plus very low versus the national average of 14.6%, and we jumped to 6.9%. We over doubled the percent of our population that was very low right after the recession from what it was before the Great Recession. If you go through 14 through 16, we remained low, and I have a prejudice. I like to thank you and our council and all of the partners because I think we all contributed to reducing that percent of food insecure households. However, we jumped starting in 2016 through 2018 to above national average, and we have remained there ever since, above the national average. Next slide, please. This slide is what's happening today, or as recent as I think it's 2021. The food insecurity due to COVID in our state jumped 26%. It was the second largest increase among the United States, and we are now the 8th highest food insecure rate in the United States. And these were the numbers. If you notice, we jumped to 15.2% of very low food insecurity, up from 12.1%. Next slide, please. This slide is a brief summary of 3 of the events that the Council on Food Security held over the last since 2013 that received publicity. We had a meeting, and I think it was here in Las Vegas. It was in Las Vegas, called A Place at the Table, the governor's office arranged for, and we had 165 organizations, both government and non-government organizations, represented at that meeting, and the participants analyzed what the situation was, and out of that, the governor created the Council on Food Security in February 12th of 2014. In 2018, the first group that we focused on was school-age kids, and I'll show you something about that on the next slide. But by 2018, we recognized that we still had some collaboration and connection problems between those organizations that addressed the issue. So we held another conference, and that was also held here in Las Vegas. And there were 50 different organizations represented at that one. And as a bias, I think it resulted in an improvement of the collaboration. We began to focus our attention on the council on seniors. Seniors we defined as over age 60. And we were going to hold an in-person council meeting to discuss the issues of and how we could reduce the food insecurity among seniors, but we have had a COVID epidemic, so we had to hold that meeting virtually. And to our pleasant surprise, we had 111 participants, and this was the first of these meetings in which representatives from 5 of our 6 representatives in Washington, in the Senate and Congress, participated. We also conducted a survey of 175 public and private agencies to find out what services they were doing around the state. And if you people are interested, the results of that survey are available in our reports. Let's move to the next slide, please. This is just a very simple overview of 2 of the what I consider successes, and I think the council will agree with me. As I said, when we first got started, we were concerned about school lunches and breakfasts because we did a survey and estimated that a minimum of 250,000 children in Nevada entered their first class at school without having had breakfast. And all of us know the impact, the negative impact that has on learning and mental health and things like that. A number of action items were taken, and by 2016, every single kid in the state had access to to breakfast before they started class. Regarding seniors, our survey from the council in 2016 indicated that we had about 80,000 seniors in this state who were food insecure. That was going to grow to a number of 100,000. I just looked at the data that we had for 2022, and it's grown to about 120,000. The survey findings and everything indicated that we had improved the services so that we were at least serving 70,000 seniors, but the surveys were not able to determine if we were serving any more. Next slide. For those of you who are new to the legislature, this is a list of the legislative initiatives that you people passed, all of which have had a very positive effect and impact on food insecurity, controlling it or reducing it. And it's been every single session since the council was created. If you have any questions about them, I suggest that you take a look at the sessions or you call us and we'll try and give you details of it. And my last slide. At this point in time, we have 3 recommendations, if you people will consider, that that going forward, particularly with the cut of the funding that the state as well as non-government organizations have been getting from the federal government, an absolutely significant reduction in funding. We would like to request bullet 1 that you reauthorize the current funding of $3.4 million for the home delivered and congregate meals and include an increase, a substantial increase of about $8 million to adjust for the loss of federal funds, inflation, and the anticipated increased demand, which is absolutely significant. Your contact is Marcy Blake, who is here if you have any questions, and Deacon Tom Roberts of the Catholic Charities. And I put that down on the slide so you know how to contact him. Second, we would like you to reauthorize the current funding of $2 million for the Home Feed Nevada Agricultural Food Program at its current level. Your contact for discussion with that is Jenny Yeager. I don't know if she's attending the session up at Carson City or not, but I gave you her data, her contacts. And if you can't get a hold of her, please contact me, and I will try and get you a good contact if you will reach out to develop an initiative that reauthorizes that funding. Third is we're asking you to consider appropriating $3.5 million per year over the next 2 years to support household food security for Nevadans to neutralize the loss from the SNAP emergency allocation funds that our state has received and agencies within our state, particularly the food banks. And we're asking that you appropriate an additional $1 million per year to support the anticipated increased demand for food from the food banks. With that, I've completed my introduction, and I'd like to turn it over to Sarah Rogers to discuss the childhood food insecurity in Nevada. And when she finishes, you can turn it back to me. Any questions?
Thank you, Dr. Osgood. We will have a couple of questions. Should we do questions? Would you mind
Why
turning
don't you
your
do
mic?
questions after Sarah's?
Great. Will you mind turning your mic off so we're not getting the reverb? Thank you so much. All right. We will have. Well, I have a couple of questions related to your presentation. I know we have other questions in the from the committee. So let's go ahead and start with questions for you, Dr. Osgood, and then we can jump into Ms. Rogers' presentation.
I've just turned the mic back on. Can you hear me?
We can, thank you.
Okay.
I have Assemblyman Gray. Please go ahead.
Thank you, Madam Chair. Doctor, so looking at your slide of the food deserts in Nevada,
Sorry. Dr. Osgood, could you turn your mic off while we're asking questions, and then you can turn it back on when you're ready to respond? Thank you so much.
thank you, Madam Chair. So, Dr. Osgood, looking at the food deserts in Nevada, I got a question, the slide and how you guys came up with that data. Looking at Lyon County, and not all of Lyon County, I would agree, is a food desert, but the eastern portion, just before you get into Churchill County, is absolutely, I mean, one of the problem areas, that we always had to deal with as a county commissioner. And then it's funny because then you go into an area that says it's a food desert, which is Churchill County, which is actually one of the bread baskets of the state. So I'm just wondering how you guys came up with that.
Let me introduce Regis Whaley from who is responsible for the what do you call your title?
Director of Advocacy and Research.
The research at 3 Square, and Regis came up with this slide for us, and he'll introduce himself and tell you try to answer your question. You gotta get that.
Regis Whaley for the record. So this data was taken from the U.S. Department of Agriculture. They have their, I believe it's the Food Access Research Atlas, where they have their list of food desert information. And so I believe for this one, it was looking at in rural areas, looking at areas where there was a significant amount of the population that was, I believe, 20 miles away from the nearest grocery store.
Following question, ma'am. So it has to do with being close to a grocery store and not the availability of food to the actual family?
So for the data that the USDA uses, they look at
I'm sorry,
food
would you-
outlets as the...
Would you please state your name for the record before you start speaking? Thank you.
Again.
Yeah, sorry about that. Regis Whaley for the record. So the USDA does look at the placement of retail outlets as as the proxy for access to food.
I think that really skews the data. I mean, that's Silver Springs, Stagecoach. Actually, part of that's probably more than 20 miles from a grocery store, but that's some of the poorest residents in this state, I would posit. And I know that food bank is always struggling to meet the need out there. And then, like I said, then going into Churchill County, I mean, you got, I won't say higher incomes, but definitely higher incomes than Eastern Lyon County and some of the other surrounding areas. And most of their population is centered around Fallon, which has several grocery stores. So it just leaves me scratching my head.
This is Dr. Osgood. I suggest that as we move forward, we just take a detailed look at that and see if we can identify who specifically is food insecure and how to address that local issue, like we've been doing in other parts of the state.
Thank you for the question. I think that's an interesting point, and brings up, are farmers markets included in the assessment?
Go ahead.
Regis Whaley for the record. No, farmers markets, as far as I know, are not included in there. They're looking at stationary retail outlets.
Thank you. I have another question from Assemblywoman Newby.
Thank you, Madam Chairwoman, and thank you for the presentation. I have sort of a two-part question. One, back on the food deserts again. Would you be able to provide more detailed information on that or a blow-up of these maps? I'd really be interested in seeing that detail. And secondly, has the council made any recommendations for policy changes to address food deserts surrounding recruiting, maybe grocery stores or other maybe policy suggestions, and what were those?
We are interested in doing that, but we were trying to recruit somebody to participate on the council who could help us. And at this point in time, we don't have an individual on the council who could take the lead to help us get that information. So we'd be delighted to have somebody help us.
Thank you. Assemblywoman Taylor.
Thank you, Chair, and thank you so much for the presentation. I look forward to learning more about our food security, food insecurity in our state. You mentioned earlier in your presentation that there was a survey, and you said we have access to, or we have a copy of it. I don't know if I don't see it in our exhibits. Did I? Perhaps I may have missed it, or can you give us a little bit more, or make sure we have that?
This is Dr. Osgood. The survey that we did on seniors and the 175 responses, I'll ask your legislative council to contact us because it's in our reports, and we give an annual report to, I guess we give it to the governor. And I'll be happy to see if we can't get you guys a copy of it. So we'll try and get that to you from our own reports.
Thank you so much. Thank you, Chair.
Thank you for the questions. Are there other questions from the committee? We have a question for you about the impact of the unwind. You mentioned in your recommendations an appropriation to meet that loss, be it to like SNAP programs due to emergency allotments. Can you expand a little bit on the impact that we've been seeing and that request?
This is Regis Daly for the record. So the SNAP emergency allotments, just to provide some background on those first of all, since about April 2020, the state of Nevada has been a part of this program through the USDA, receiving those emergency allotments. It's been roughly $40 million per month coming into the state of Nevada to support households that are participating in SNAP. The last of those emergency payments will be issued in March. So after that, there won't be what has been a second payment going out to households participating in SNAP. So we're talking about, again, across the state, $40 million worth of food purchasing power that's going to be lost from those households. And looking at other states that have already ended these emergency allotments, because many states have already, in 2022, on average, the states that ended their emergency allotments experienced roughly a 16% increase in food insecurity. That's based on some data from the U.S. Census Bureau. So that's what we're looking at here in Nevada, and the reason for asking for the appropriation in that amount is looking at potentially a 16% increase in food insecurity, and the food banks being able to support those who will be losing the allotments.
Thank you for that response. Can you break down a little bit for us what the amount lost per family in different scenarios would look like? Because I know that senior populations receive a different benefit than family populations do. Can you just talk a little bit about what's that difference that we're looking at in the benefit as that funding goes away?
For the record, and I can send that over to you. The Nevada Division of Welfare and Supportive Services has a few scenarios that they've walked through, some different income amounts and different household sizes, which are two of the primary determining factors for determining what the amount of loss is going to look like. But we're talking about some very stark losses. So one of them I can remember off the top of my head for our seniors, just because it was such a drastic increase. You're talking about seniors that are going to go from receiving nearly $300 a month in SNAP benefits down to the minimum of around $20 a month in benefits. So if you can imagine being a senior, having no other income, and having $300 during this time of increased food costs and inflation, all the things that we're all experiencing right now, going from $300 a month for your food budget down to $20, it's going to be hard times for a lot of folks out there. And so the food banks, we've been in talks with DWSS. We're here to support, and we want to make sure that whatever we can do on the food bank side, that we're here to do it for Nevada.
Yeah, the magnitude of that is unimaginable to me. I think about the constituents that I hear from, in particular our fixed income senior populations who are already struggling with raising rent rates, and that emergency fund offset some of those impacts to them. So adding to that inflation and cost of food today, cost of gas and other transportation, as well as the cost of healthcare, it doesn't settle well. Are there any other questions from the committee? Thank you so much for the presentation. If you'd like to stick around, we may have questions that pertain to the issue areas you brought up today following Ms. Rogers' presentation. So you're welcome to stay around if you'd like.
We'll be here. We'll be here.
Thank you so much. Our second presentation today will be on childhood food insecurity in Nevada with Sarah Rogers, who's the Nutrition Unit Deputy Chief of the Bureau of Child, Family, and Community Wellness. Thank you so much for being here. Would you please proceed when you're ready?
Absolutely. Thank you so much for having me. Food security means the ability of a person to access enough food for an active and healthy lifestyle. The Nevada Office of Food Security is located within the Division of Public and Behavioral Health Nutrition Unit, and the mission of the office is to effectively improve the life and health of Nevadans by increasing food security throughout the state. The guiding principles of the office include incorporate economic development opportunities into food security solutions, use a comprehensive, coordinated approach to ending hunger and promoting health and nutrition rather than just providing short-term assistance, focus on strategic partnerships among all levels of government, communities, nonprofit organizations, including foundations, private industries, universities, and research institutions, use available resources in a more effective and efficient way, implement research-based strategies to achieve measurable results. The target populations we focus on are food insecure Nevadans, with an emphasis on children and older Nevadans. In addition, the office staffs the administrative support for the Nevada Governor's Council on Food Security and supports the implementation of its guiding plan, Food Security in Nevada, Nevada's Plan for Action. As Dr. Osgood mentioned previously, Nevada currently ranks 8th nationally among states with projected overall food insecurity. We are also 8th for projected very low food security rates nationally. Nevada's 3rd congressional district is one of the areas with the highest national projected food insecurity rates, with an increase of 36,970 individuals projected to experience food insecurity, as well as the highest projected very low food security rates, with an increase in 17,430 individuals expected to experience very low food security. As of 2021, Nevada ranks 5th, or at 23%, for states with highest projected child food insecurity rates. We are below Louisiana at 26%, Hawaii at 24.6%, New Mexico at 23.7%, and Texas at 23.6%. And for states with very low, projected very low food security rates in children, Nevada ranks 2nd at 8.1%, just below Oklahoma at 8.4%. When it comes to national household characteristics for food insecurity, households below the poverty line or single women head of households with children are the most likely to be food insecure at 33% and 24% respectively, followed by single men head of households with children at 16%, then dual head of households with children at 8%, and households with elderly individuals at 7%. Black non-Hispanic individuals are the race and ethnicity most likely to be food insecure at 20%, followed by Hispanic at 17%, other non-Hispanic at 10%, and white non-Hispanic at 7%. The WIC program is located within the Division of Public and Behavioral Health's Nutrition Unit, and it is a supplemental nutrition program that aims to safeguard the health of young and expecting families through nutrition and breastfeeding support and education, as well as an issuance of a monthly tailored food package. At the start of the COVID-19 pandemic, the WIC saw an initial increase in participation rates. However, participation has continued to fall across the state in all WIC programs, and as of 2022, We are down to 40,023 children 0 to 5 participating in the program, and that is a drop from 45,225 from 2020. The SNAP program has seen an increase in participation for children under 18 years old from the month of April 2022 compared to January 2023. And based off of federal regulations, SNAP participation does make a categorically eligible child or parent adjunctively eligible to participate in WIC. However, as you can see from these numbers, SNAP participation for 0 to 5-year-olds is over 20,000 more than 0 to 5-year-olds participating in the WIC program. So that is a major gap in those who are eligible to be served by the WIC program. As this Assembly heard last Friday from the Division of Welfare and Supportive Services, starting April 1st, participants will see a decrease in their SNAP benefits. While this continuation is happening across the country, this is a decrease in over $43 million per month in Nevada alone. The average one-person household, this graph does represent 92% of the total SNAP participation currently. The average one-person household on April 1st will see almost a 47% in monthly SNAP benefit reduction. A two-person household will see 43% in reductions. The three-person household will see almost 34% in reductions, and a four-person household at almost 36% in monthly reductions. So what does the discontinuation of the SNAP emergency allotment look like for the average person, family, or senior? Currently, there are 31,940 single-parent SNAP households. They will experience an average monthly loss of $152.51. There are 47,918 one-person households where the member is 60 years or older. Their average loss per month will be $131.86. There are 11,444 two-person households where both members are 60 years or older. Their average monthly loss will be $231.49. Additionally, seniors who received unearned wages, such as RDSI or SSI, will see a decrease from $281 per month to $23 per month. Now, as we are all facing the end of the SNAP emergency allotment, we need to look at overall impacts this will have on Nevadans. We know that there will be disproportionate impacts on racial and ethnic minorities, senior citizens, households with children, and people with chronic diseases. Programs will have to pivot quickly and enhance programming to adjust the increased need. Inflation is already making it very hard for our partners to purchase enough foods. WIC does anticipate an increase in participation as a result, and luckily WIC is maintaining their cash value increase in fresh fruits and vegetables, which was started because of the pandemic, and that was an increase of $9 for children and $11 for women to now $25 a month in fresh fruits and vegetables for children, $44 a month for pregnant and postpartum participants, and $49 a month for exclusively breastfeeding participants. However, the barriers that have created this gap in SNAP and WIC participation still exist. Those include needed WIC technology improvements. We know that SNAP now offers online ordering and delivery, whereas the WIC program does not have those capabilities. The requirements to become certified on WIC are a lot more stringent. We also require WIC participants to maintain a quarterly appointment schedule and nutrition education requirements. And unfortunately, the WIC program is still perceived by many as a formula program, which, as an Abbott contracted state, in the wake of a formula recall and formula shortage, we have still experienced some hesitancy from participants and new participants. Now, pregnancy and childhood is a vital time to establish good health for lifelong impacts, and some implications of food insecurity at this stage include birth complications such as low birth weight, poor maternal health outcomes, iron deficiencies, also developmental issues like stunted growth, anemia and asthma, oral health problems, mental disorders, lower cognitive levels. There are overall negative health outcomes, lower quality diets or nutrition insecurity, higher healthcare costs, and higher obesity rates. Now, some of the current efforts of the Division of Public and Behavioral Health to mitigate food insecurity include the 2023 Food Security Strategic Plan, which should be ready for release anytime this month. This plan has more of an emphasis on collaboration across the food security ecosystem, non-typical food security partners such as transportation and housing, and those with lived experience. We are also currently going through a new round of Funds for Healthy Nevada notice of funding opportunities, which are being reviewed for food security work through state fiscal year 24 and 25. WIC and SNAP are also working together to streamline their referrals. Nevada is also one of 5 states that was awarded the WIC online ordering grant, which we are hoping to use to explore expanding shopping options for WIC participants to make shopping easier and reduce the stigma in stores. Nevada WIC is also supporting multiple local organizations and applying for an upcoming WIC Innovation and Outreach Grant, which we hope will raise awareness of the program and increase participation. Happy to answer any questions.
Thank you so much for the presentation and for covering some of this information. It helped answer some of the questions that I had earlier.
Yeah, sorry about that.
No, that's okay. I was the one who chose to switch it up. We have several questions, though, from committee members. I'm going to go ahead and start with Assemblyman Nguyen.
Thank you, Chair. Thank you, Ms. Rogers, for the presentation. Just want to ask you the question about, on slide 11, we mentioned the data on ethnicities and how they impact for ethnic and minority community. I wondered on slide 6, you mentioned national data. Is there Nevada data in terms of race and ethnicities?
Not that I have currently available, but I can find out for you.
Great, awesome. May I have a follow-up, Chair? Thank you. I know we didn't mention in terms of formulas and how the funding for SNAP here on these slides. Just out of curiosity, do you know if the state kicks in any types of SNAP matching? Because I know that for nonprofit organizations that work with the SNAP program, they only given 47 cents per dollar from the federal budget. Is that 47 cents has any types of state money in there at all, or is it just all federal?
Sarah Rogers for the records. I will have to follow up with our Division of Welfare and Supportive Services
Okay.
for that question.
Great. Thank you. Thank you, Chair.
Thank you. So we have folks, representatives from Three Square and Food Bank of Northern Nevada here. If they have any response to that, we're welcome to come up and share your knowledge.
Thank you, Chair Peters. My name is Shane Piccinini, and I am with the Food Bank of Northern Nevada. So, Assemblyman, when to your question, the money through the SNAP program is exclusively federal dollars. There's a thing called the SNAP match that the state has to put towards the federal grant, but that doesn't apply additional dollars to the client. It is for the administrative operation of the SNAP program.
Thank you so much. Do you, Mr. Whaley, do you have a response as well?
For the record, nope, Shane's got it.
Fantastic. Thank you so much for sharing that information. I have Assemblywoman Taylor next.
Thank you, Chair. Thank you so much for the presentation. If you will allow, I'll have 2 questions, Chair, if you will allow. I'll be quick. On slide 5, and I'm sure you spoke through this, and I may have been taking a note and missed it. Help me understand the difference between the 2 rankings. One is we're 5th for states with the highest projected child food insecurity rates, but then we're 2nd with very low food insecurity rates. I don't help me understand that.
Yeah, absolutely. Sarah Rogers for the records. So when it comes to food security, I believe there's 4 tiers. And so very low food security would be the bottom or the most severe, and that's where there is a disruption in one's eating patterns. Whereas projected food insecurity is the top tier, the beginning tier. So it just goes down in the tiers. So very low food security is where we see disruption in eating patterns, missed meals, more severe issues like that.
Okay, I see. So really, they're two different scales.
Yeah.
Okay, I was trying to figure out how they fit together, and they don't. Okay, so that answered that. Cheers. Thanks, Ms. Rogers. Second one, just for my own clarification, I'm pretty sure I have this, but talk to me a little bit. You mentioned about how sometimes WIC and SNAP work together. Could you give me a little basic of WIC? I know that's for women and children, and then SNAP. Help me understand really clearly the differences between the two and how they should work together.
Yeah, absolutely. Sarah Rogers for the records. So the WIC program, also supplemental nutrition program, is completely different from the SNAP program. They have different income limits and requirements. The WIC income limits are higher than SNAP, which is why I mentioned if you participate on SNAP, you're adjunctively eligible to participate on WIC because it's assumes you meet the income requirements because they're higher for WIC. WIC also has some more nutrition ed and breastfeeding components, and we also require height, weight data to be collected and iron as well. And so there are more touch points for the WIC program. It is meant to be a short-term program where we provide the medically tailored meals and then also the nutrition education to help them sustain the good eating habits once they no longer qualify for the WIC program, because it is for pregnant women or individuals, breastfeeding individuals up to 1 year, or postpartum individuals up to 6 months, and then children 0, and then they're cut off at their 5th birthday.
And so, if I may follow up, Chair. Okay, thank you. And so, if you're WIC is easier to qualify for. So if you qualify for SNAP, then you're going to be getting WIC.
Income-wise, yes.
Income-wise, right? And
Yes.
then and WIC, the whole idea is that's a more severe case. In terms of the health of the children, it sounds as though there's some things involved in terms of their weight or their. Did I misunderstand that?
Yes, so Sarah Rogers for the records. When someone participates in WIC, we identify them as having a nutrition risk, which, pregnancy can be considered a nutrition risk. And so they have those additional components. But as far as measuring height, weight, iron, those are just other touch points of the WIC program that we use to help safeguard the health. So we're following that really closely with the participant while they're participating in the program.
Okay. And the whole idea is to get them off of WIC.
Yeah, it's a long-term health solution is the idea, yes.
All right, thank you, Ms. Rogers. Thank you, Chair.
Thank you. I have a quick follow-up on that description of the metrics that are collected from the families that are participating in WIC. Is that state requirement or federal requirement?
Sarah Rogers, it is a federal requirement.
Thank you. I have Assemblywoman Thomas next. Thank you.
Thank you, Madam Chair. Appreciate the presentation, both presentations. Excuse me. My question actually deals with slide 6. When you were giving the percentages of households characteristics, I was just wondering, is this indicative of Nevada or around the country?
Sarah Rogers for the record. This is a national characteristic.
Follow up, Chair, please. Is there any way for your DHS to break it down for Nevada so that we can see areas where we, in like my district, 17, in the south there, so that I can actually visualize where the deficiencies are?
Sarah Rogers for the records. I can absolutely work with our analytics department and see what we can get for you.
Thank you. One more follow-up, please. Thank you. Okay, and then on slide 12, I was just wondering, do you have the data when you are giving us the birth complications? And this means a lot to me. For Black, Brown, and Indigenous, do you have the data that supports whether or not death of these babies have incurred because of nutrition, lack thereof?
Sarah Rogers for the records. I can work with our maternal child and adolescent health program, who does have the maternal mortality review committee as well as the infant fatality review committee.
Thank you. I appreciate it. Thank you, Chair.
A fantastic question. Thank you so much. Assemblywoman Gorlow.
Thank you, Chair. And I want to kind of go back to what my colleagues were talking about with WIC and those metrics that you're collecting, the iron, weight, and height. Can you talk a little bit about how you collect those, and do you see that as a barrier?
Absolutely. Sarah Rogers for the record. So for the iron, it's usually a finger poke in the clinic. Some clinics will contract out, so the participants will have to go to a different clinic or nurse to get the finger poke to read their blood iron levels. And the height and weight is usually collected in the clinic, or they have to get it collected from the doctor, and then the doctor faxes that over. And we do see it as a barrier because it's an additional step to becoming certified for the program and then also maintaining certification of the program.
Thank you. I think it's important to bring up, if they have to go to a nurse someplace else, many times transportation is an issue, and so I would have some concerns about that. But as you mentioned, that's a federal requirement, so not sure what we can do about that. But if I could have another question, please? Thank you. We've talked about food insecurity and people not having food, and then in the bullet points and in presentations, it talks about higher obesity rates. So I think for some people that might seem a little bit more like an oxymoron. You don't have food, yet you're heavy. So I was wondering if you could elaborate for others to explain a little bit how that works together.
Yeah, absolutely. Sarah Rogers. So when it comes to the higher obesity rates, a lot of the times it's not necessarily to do with the amount of food, but the quality of food you have access to. And that also has a lot to do with food insecurity and nutrition insecurity. Whereas oftentimes, the foods that have the higher energy requirements are more processed or cheaper and easier to access.
Thank you very much for putting that on the record.
Thank you.
Thank you so much for the questions. Follow up on the WIC criteria. There's no waiver program for WIC on those obligations to measure weight, height, and iron metrics.
Sarah Rogers. Throughout the pandemic, there was a waiver so that we could waive that as much as possible. The participants were going, who went to the doctor, we were just having the doctors fax in when they could those updated height and weights. But that's not a long-term waiver, and it's ending at the end of the public health emergency.
I just want to point out for my colleagues that we're not the only one who take fax. It's a state thing, apparently. I would like to invite our food bank partners to talk a little bit about the quality of nutrition that you provide to folks who use your services. Can you tell us how you're engaging in high quality foods and fresh foods, and what kind of the difference is that it makes to people's lives?
Sure. Shane Piccinini, the Food Bank of Northern Nevada. Our food bank has, for the last 4.5 or so years, been engaged in sourcing food that are lower salt, lower sugar, but we're also, we encourage client choice, but we've got identifiers through our different pantries. We've got about 150 partner agencies where there's a red, yellow, and green tag on there. Greens obviously would be like the lowest processed foods, lowest sodiums that are healthier. Yellow is, yeah, sure, go ahead, but not every day. And then red is like, are you kidding? But a lot of this is client or neighbor education and what healthy food choices are. And, it's a long-term process because we want them to choose to be healthier. We do not want to tell them how they and their family should choose to eat. And then also part of that has to do with the availability of culturally sensitive food or the inability of that. So there's a bunch of different factors that play in the role of what is considered to be healthy eating and what families consider to be healthy eating.
Mr. Whaley, do you want to?
Whaley for the record. Oh, sorry, yeah. Yeah, Regis Whaley for the record. Many of the things that you're hearing about from Shane that are happening at Food Bank of Northern Nevada are similar things that are happening here in Southern Nevada at 3 Square. The system that Shane is referring to, that red, yellow, green kind of stoplight system, is actually something that is being worked on through the Robert Wood Johnson Foundation, who's the largest philanthropy in the U.S. working on public health issues. So there's a lot of research and support that goes behind that. One of the goals that we have at 3 Square is looking at how much fresh produce we're putting into the community. And so we do have some internal goals around that of making sure that at least 40% of what we put out there is just fresh fruits and vegetables, because we know that that's not always easy to come by, especially for our neighbors who are experiencing food insecurity. We also take a look at the way that we are doing purchasing and procuring food through our other channels, trying to figure out how do we optimize the nutrition that's coming through there. And so looking, just like Shane had mentioned, looking at some of the low sugar, low salt options, but also thinking about on our proteins, looking at lean proteins, making non-meat proteins available for those with different food preferences or food allergies. So food banking has been an important part of, I think, of at least our 2 food banks, and it's something that in general across the country we're seeing food banks take part in.
Thank you for your responses. I know in my life, cooking has been a large part of how my family saved money when I was a kid, because my mom knew how to cook. That's often a barrier for folks with fresh foods, is not knowing how to make them taste nice, or not being familiar with the tastes that you can create with fresh foods. And I know in other areas I've heard on radio segments that they're introducing like cooking classes as part of some of these programs. Are we doing anything like that in Nevada with yourselves or partners?
Shane Piccinini for the record. We do have a nutrition education program that we work with our neighbors that does demonstrations of recipes and how. So we have a program called Mobile Harvest that delivers a 53-foot tractor trailer into neighborhoods to directly distribute fresh produce. So we distribute recipes through that, but we also have the nutrition education department within our programs division at the food bank that goes out and actually shows clients and neighbors exactly how to prepare some of those foods and to give them healthy options for what we are distributing.
This is Dr. Osgood. Can I add?
Please go ahead.
Here, for many years, the University of Nevada's extension program has had those kinds of cooking programs offered here in the Valley for many, many years, and they're very, very active in that, at least in the southern half of the state. I assume their extension in the northern half of the state is doing the same. There was one other comment I wanted to make about WIC, if I can.
Please go ahead.
Is it appropriate? Please go ahead. I unfortunately was involved with the creation of WIC while I was treating children just on the other side of the Grand Canyon on the Navajo Reservation when I served in the Public Health Service. And we were trying to keep alive children who were born and had within 6 months of age kwashiorkor and marasmus, the diseases that you see in Africa. We had it here in the United States. And our physicians and nurses wrote a report that was picked up by Congress, and out of that, we were pleasantly surprised that they created a supplemental program called WIC, and it was specifically targeting children up to the age of 1 to try and make sure that we eliminated those problems. So the WIC is not a federal program for all other age groups, just to let you know.
Thank you for that
Any
follow-up.
questions?
I asked staff on the side here to pull up the annual income limits for SNAP program. And I just want to bring folks' attention to slide 9 as we talk about this. So to give you some perspective on the loss of income that we're looking at, the maximum income for a household of size 1, right, which is that first row on the table here, the maximum income is $17,667. That loss of $132 is almost 10% of that income. For a household of 2, the maximum income is $23,803. Again, almost 10% of that income is lost. For a household of 3, the max income is $29,939, and a household of 4, the max income is $36,075. I just wanted to give you some perspective of what we're looking at in the fallout here of the SEA program loss. Are there any other questions from the committee for these experts today? Thank you so much for being here. We really appreciate your time spent with us this morning or this afternoon on Friday. I think these are really important issues, and particularly because we are looking at the loss of some of these benefits. It's important for us to know what we're looking at and consider what we can do to help. So I appreciate you all being here. Thank you, Dr. Osgood and Mr. Whaley, for being here in Las Vegas with us. We appreciate it. I'm going to close out that agenda item today and move on to our last agenda item, public comment. We ask that public comment be kept to 2 minutes and ask that commenters avoid repeating comments that were made by previous speakers. We all love a ditto. Staff will be timing each speaker during public comment to ensure everyone's given a fair opportunity to speak. Please clearly state and spell your name for the record, and then we will start your time. We will begin with public comment from those who are in our physical locations. Is there anyone in Carson City who would like to present public comment today? Seeing none, is there anyone in Las Vegas who would like to present public comment today? Seeing none, I would ask BPS to please open the public comment line and add the public commenters, folks who may be on the line for public comment to the line. Thank you.
Chair, the public line is open and working. There are no callers at this time.
Thank you so much. We're going to close public comment for the day and move on to the end of our agenda. Are there any members who would like to share comments or questions? Thank you so much. Seeing none, our next meeting will be on Monday, February 20th at 1:30 p.m. We will see you all here. And with that, the meeting is adjourned.